when you go into the
eating and drinking. Basically, the rule is no drinking for 2 hours before the operation, so your stomach's clear, and no eating for 6 hours before the operation. Because of course, when you have an operation, your stomach is clear. But we will go through exactly when to stop eating and drinking with you quite clearly before the operation.
Yeah, it's usually all written down in your paperwork. So. We use the BMI hospital, so whatever hospital you're having your surgery at, you come in early in the morning, you have your own private room with an ensuite, and you tend to get admitted by a nurse, by one of the nurses at BMI, and then you'll be seen by Mr. Richards. So you'll always see him on the morning of the operation anyway. You go through the size of the appointment that you had with either myself or Aggie, go through the implants, and you'll be able to tell them your feelings and what you like best and what we're actually going to aim to put in there. You then also get to meet the anaesthetist. So we usually use a consultant anaesthetist. So if people are worried, you're usually in really, really good hands. They'll talk you through the anaesthetic and hopefully put you at your ease. When it's your time then for theatre, the nurses will walk you down to the anaesthetic room. You'll be put to sleep in there by the anaesthetist, who's really will make you feel at ease, and then you have your surgery.
Yeah. And there's 2 ways of being put off to sleep. One is by a tunnel injection in the back of your hand, where they inject the white liquid and you go to sleep before you count to 10. Some people don't like that. Some people prefer gas, just to breathe in the anaesthetic. We can do that. And the nurses will also put white cream on the back of your hand to numb the back of your hand, so you won't feel the needle going. So the anaesthetics are really, really good now. As Sinead mentioned, we use consultants, anaesthetists, really experienced. I've worked with them for many years, and the operations, as safe, I would let a member of my family have an anaesthetic, these consultants, because they're very, very experienced. Interesting, when you're having your operation, you're not aware, it's not like dreaming, you're not aware of time going by. It's almost like you fall asleep, then you immediately wake up, and patients ask, has it happened? Has it happened?
Yeah. And usually quite comfortable, really.
Yeah.
Afterwards, might be a little bit sore, but you're not really in very much pain.
Under the muscle operations are a little bit more uncomfortable.
Yeah. Most patients tend to say that it feels tighter, that you almost feel there's a pressure on your chest, but it's fine, it's manageable. We do cover you very, very well with painkillers. So if you did wake up and you were feeling you had a little bit of pain, you'd be given something straight away. We wouldn't leave anyone in pain. But most patients tend to go home on the same day now, so they tend to recover fairly quickly.
Anaesthetics have changed a lot from the old days when people were sick and felt bad for ages. They've changed the medicine they give you. So most people go home on the day. The operation lasts an hour, but you'll be away from your room for an hour and a half, possibly.
Yeah, an hour and a half to 2 hours.
Because we like to keep you in the operating suite just until you're absolutely stable. And most people are having their lunch or their dinner within an hour of getting back to the room. And as we say, we normally have day casing. How will they look immediately after the operation?
At first, I think you're going to have some swelling. So, for patients who didn't have very much there in the first place, it can be a little bit of a shock because you've got swelling. So they look a little bit bigger than they will end up in 6 weeks down the line. You will have a surgical bra on that we provide you with in theatre. So you won't really be able to see very much, but what you'll see is, the top part of your breast, and like I said, that will be swollen, but it will settle down. The surgical bra you then wear for a week afterwards, and then we can talk about that in a few minutes about the post-op care. But most patients feel, because they've gone through the process of seeing us beforehand and maybe trying the implants on the sizing, and they're actually quite happy because it feels right straight away. That's what a lot of patients say.
Yeah. Just a couple of things about the operation and why Raw is slightly different. We use a surgeon device called the Keller funnel, which allows us to put the implant into very short scars, so much shorter than the average 5.5 centimetre scars. Our average scars in the region of 3.5 centimetres, and the funnel also minimises the surgeon having the contamination of the implant, and may reduce the risk of infections and capsules. To find out more about the exact technique we use and why we think our technique is the best, have a look at some of the videos on the website. So, patient wake up, Sinead, and what medicines will they be given and what should they expect?
So you wake up, you'll be brought back to your room, and if you've got friends and family, it's fine for them to be there with you. So long as you've had something to eat and drink, and we get you up for a little walk, and everything's been cleared, you've been to the toilet, everything's fine, then we usually say wait an hour or so and you'll be able to go home. You do go home with some painkillers, which tend to be paracetamol, which is a great painkiller if it's used properly. So we tend to say every 4 hours for the first 5 days. You'll also be given an anti-inflammatory drug, depending on what the anaesthetist uses. And we ask you to take that twice a day to have the inflammation to go down, so the swelling to go down. You'll be given all of this on an advice sheet before you go home, so you will know how to take the medication. Most patients, we do say, take the medication for at least 5 days because it does help you get over that initial stage. Some people say they don't need it and it's fine, that's up to patients, but our recommendation would be about 5 days post-op to take the meds.
And obviously we have our hotline. If you have any concerns, you can get through to us straight away. And a week following surgery, you would see one of our nurses staff, may well be Sinead. And what happens next?
So at that appointment, so for the week we ask you to leave the surgical bra in situ. You come and see one of us a week later, and we just remove the surgical bra for the first time. Where your scars lie, just below the fold of your breast, you have 2 little pieces of tape that just need to be removed. The scar just cleaned with a little bit of salt water, nothing else, no stitches to come out, and then we put some fresh tape back on at that appointment. At that stage then you'll be able to start showering as normal because we like you to try and keep that area dry for the first week. And hopefully then you can start driving again and things like that, which we will give you advice on that appointment. And then you're allowed to take the bra off for 1 hour every evening for the next 5 weeks.
And you can switch to whatever's most comfortable, so it could be a sports bra, and we can give you bra recommendations. So a week in the surgical bra, and then
then you can change to something.
Yeah, and there's no stitches to remove. All the stitches are buried, so no stitches to remove.
Which is quite nice because a lot of patients think they're going to have sutures removed, but they don't. So it's just literally removal of dressing and then replace with some more tape.
Because all the stitches are absorbable and buried. The other thing we don't do is we don't use drains for breast enlargement. Studies have shown that it increases the risk of the operation, and of course they're painful and uncomfortable. So we don't use any drains. So after that stage, we'll generally see you.
We see you then usually 6 weeks afterwards for a follow-up appointment. Before that, we tend to, I would then probably talk you through about how to do your dressings, but it tends to be just a change of tape twice a week after that, up to the 6-week appointment. We'll explain about no exercise for 6 weeks afterwards, no heavy lifting. Driving, I say, after 1 week you can. But you just need to take it easy really, just listen to your body in that first 6 weeks. When you then come to see us at 6 weeks, you'll be seen by Mr. Richards and one of the nurses as well, and we will tend to then remove the bra, and then you won't really need to wear a supportive bra at that stage. We'll remove the tapes that you had in place, and we'll do some photographs, because we like to do before and after photos. So you'll have your first set of photos taken at the sizing appointment, and then we'll do your 6-week photos, which we can always send you if you wanted to see before and after, but it's good for us to have it for our medical records. And just answer any questions you have, and we'll go through then about how to start exercising again, getting back to a bit more normal life, and how to look after you, which tends to be that we like to see you every year for a follow-up appointment as well.
And just to say, obviously I'm based in the south of England and tend to specialise in breast surgery. For many people it's not very convenient to have treatment with me because where I'm located. So we do have a network of Aurora partner surgeons throughout the country who do very similar treatments and are specifically trained in the Aurora approach. So the thing to do probably if you are considering breast surgery, it's a big decision to make. Really important that you do your research and find the right surgeon for you. So one thing maybe worth doing is having a look through our website, having a look through the videos, and possibly listening to our information CD. So we have a free information CD we can give you. We have a DVD as well, talking about breast enlargement surgery. That's a free service that we'll give you. And then possibly scheduling a consultation with either one of our surgeons or one of our nursing staff. We do Skype consultations if that's something you would like as a preliminary consultation, but we obviously do need to meet you in person prior to any surgery. So any points really?
I think just to say that, you know, when you come to Aurora, you're here, and that, you know, everyone knows that there's lots of people to talk to about different questions and answers. So there's always someone on the end of the telephone, or as Mr. Richard said, on our website. Our website is really, really informative. But, you know, we love to see you. So if you do come, you're an Aurora patient, and then the journey continues from there, really. We like to see you every year. We have an open door where, if you do have your surgery with us, any worries or concerns, you just come back and see us.
Is that okay? So I think the best thing to do is do your research, which you're obviously doing because you're listening to this, and then if you have any questions, come and see us in person or contact us. We'll be delighted to answer the questions for you.
We have actually had a question come through saying, can you have the surgery without having an anaesthetic?
You or me?
You can know what I'd say.
Right. Well, obviously you do need some anaesthetic. I mean, anaesthetic means basically reducing the pain. Okay? So a local anaesthetic is an anaesthetic, and all that means is, so in a general anaesthetic you're put to sleep. Generally, your whole body is put to sleep. In local anaesthetic, a bit of your body is put to sleep. That's why it's called local, because the area is local. So it is, so some surgeons do breast augmentation under local anaesthetic. So you just numb the area up, you're awake, and you have the operation. The next stage is called twilight anaesthetic, so local use, but you also make sleepy. And the next stage is a very light anaesthetic. There are different types. The most commonly used one is called TIVA, and that's where the anaesthetic is just, you know, the white stuff that's put in to make you go to sleep. You just have a light infusion of that, which makes you sleepy, and you wake up immediately after the operation. So, in answer to your question, you do need a anaesthetic, and generally at Aurora we would like to use an anaesthetic where you are not aware of the procedure. But they're much lighter anaesthetics than the old-fashioned general anaesthetics, and we can talk to you all about the different anaesthetic options when you come in.
There's another question. Would having a breast enlargement affect breastfeeding?
Yeah, no, it shouldn't affect breastfeeding at all. Wherever the implant is placed, whether it's behind the muscle or in front of the muscle, your breast tissue is in front of the implant. So it's always your breast tissue, and then you've got your milk duct. So it's not affected at all by the breast implants. The implants that we use as well are very safe, and they've been shown that there is no reason for you not to breastfeed with them in. So a lot of our ladies go on to successfully breastfeed, and yeah.
It's a very good question, because whether the implant is behind or in front of the muscle, it's always behind the breast gland and the breast ducts, as Sinead says. So the milk which is produced in the milk ducts, can get to the nipple. So breast reduction and uplift surgery, the ducts between are divided. So you may not be able to breastfeed after reduction and uplift, but generally you are after enlargement. We'd like to say how the bust can change.
Yeah, so if you're a lady who obviously hasn't had children and you have your breast implants in, when you do become pregnant and then your milk comes in, your breast will swell anyway and they'll change. So the implant would still stay in the same position, and that it shouldn't really alter the implant, but your breast tissue would change. So whether you're someone who puts on weight in pregnancy in your breast area, or because of the milk coming in, and then if you stop breastfeeding, obviously it will go down, it might change how your breast looks. At Aurora, we give you a warranty card for your implant, which says that the implant should be fine and shouldn't have any reason to change through pregnancy or breastfeeding, but your breast tissue itself might change. So sometimes patients might find that the breast looks different after pregnancy or breastfeeding, but it'll be because of your breast tissue, not the implant.
Yeah. The implant doesn't change, as Sinead said, it's the breast tissue over the implant that changes sometimes. But generally people with breast enlargements fall into two categories. There are either people before child, have children, or after. People before are people who have developed busts, have tuberous breasts, or difference in the size of their breast, or not happy with it. It may not be the size, it may be the shape of the bust they're not happy with. And then afterwards, after childbearing, having children, finishing a family, it tends to be people who lost volume from their bust. the bus gets emptier on the top. Any comments on that?
Yeah, I think you're right. Exactly what you say. It's two different categories, and but having seen a lot of patients who haven't had children, and then they come back because people come back for the yearly checks. The breasts with implants in tend to look very good.
Yeah.
They do tend to look still very youthful and very where they were placed really. So yeah, it's good really, I think, for both, isn't it?
Yeah.
And then ladies who have finished their families, because they have breastfed, so they've had breasts that maybe are not the breasts they wanted because they might be drooped inside or sagged a little bit, because they have their implants afterwards, they're quite happy because they're staying where they are.
Yeah. Yeah. But generally, if you're in the middle of having children, we would normally recommend that you finish having children before getting things fixed.
And one more question, how long do the implants tend to last?
Oh, do you want this one? Yeah. Well, this is a very interesting question. Now, basically, the implants are very, very stable. We tend to use Nagor implants. We do use the other manufacturers. So I always say that the implants are a bit like Audi, Mercedes, and BMW. They're all really well made. They're all very high quality. But Audi, some people like Audi, some people like Mercedes, and some people like BMWs. It's personal choice. I tend to like Nagor implants. They're British built, very soft, and I actually visited the factory and can verify to their quality. Now, how long do they last? Well, as Sinead mentioned, the implants are very reliable. It's us that are not so reliable, so it's our tissue changes around the implants. So generally we would recommend that we see you every year, we scan you regularly, certainly if there's any change in your bust, we scan it. And generally we recommend exchange of implants between 10 and 15 years. But if scans show that the implants are fine and you've got no issues with the implants, we tend to leave the implants and adopt a sort of wait and see monitoring policy. So the implants do last a long time, but they do need to be monitored. Great, so just like to say thank you very much for coming to the webinar. Please have a look at the rest of the stuff we've got online. Lots and lots of videos, lots of information, lots of patient testimonials. Anything to add, Sinead, really?
No, just we'd love to see you. Yeah, we're always here.
Yeah, we don't go anywhere.
No.
Thank you very much.